Sometimes normal delivery is not safe. In these cases, doctors perform a cesarean section. In this video, you'll see step by step how a baby is delivered through C-section. A C-section is a surgical method of childbirth in which the baby is delivered through incision in the abdominal wall. This procedure is performed by trained doctors when normal vaginal delivery is risky or not possible for the mother or baby. Common reasons for C-section. Breech position. That is baby's feet or bottom facing down. This placement of the baby causes difficulty in normal delivery, due to which doctors recommend to opt for C-section. Placenta previa. That is placenta blocking the birth canal. It also causes difficulty in normal delivery, so C-section is recommended. Multiple pregnancies, that is twins or triplets. Due to multiple pregnancies, it becomes nearly impossible to deliver normally. Previous C-section. It causes risk of uterine rupture, so another C-section is performed to prevent the uterine rupture. Maternal conditions, such as high blood pressure during pregnancy, gestational diabetes, and lastly, maternal infections during pregnancy. These three conditions are also the causes for C-section. Prolonged pregnancy is also the cause for C-section. Body preparation before surgery. Patient consent must be taken before the operation. After consent, blood pressure and all other vitals are checked. An IV is then placed in a vein in the hand or arm. The IV provides fluid, medicines and antibiotics to prevent infection. A urinary catheter is then placed to keep the bladder empty during the procedure. The abdomen is cleaned and sterilized for the surgery. Family members patiently wait outside during the operation. Anesthesia used in C-section. Most C-sections are done under spinal or epidural anesthesia. This means the mother is awake, she feels no pain. She can hear the baby's first cry. In rare emergency cases, general anesthesia may be used. Step-by-step C-section procedure. The doctor makes a horizontal or vertical incision just above the pubic area, also called a bikini cut. After this, skin, fat, muscle are cut, and a small incision is made in the uterus to reach the baby. The baby is gently delivered through the incision. The umbilical cord is clamped and cut, and the baby is handed to the pediatric team. After the baby, the placenta is removed. The uterus and abdomen are stitched carefully in layers. The entire procedure usually takes 30 to 60 minutes. If you found this video helpful, please like, share and subscribe for more informative videos.